Okay, I'm Dr. Paul Lehrer. I'm a psychologist and I teach at University of Medicine Dentistry of New Jersey in the Department of Psychiatry. And I have been doing research with heart rate variability and heart rate variability, control of heart rate variability for many years. As many of you know, heart rate never stays constant. When the doctor measures your heart rate in the office and says you have a heart rate of 75 beats a minute, it's not always 75 beats a minute. In fact, it changes every second. And that change is good. Change is, variability in heart rate is a sign of health. And heart rate changes with a lot of factors. It changes with the amount of stress you're under, with the amount of physical activity that you're undergoing. And it also changes according to certain internal rhythms. And those rhythms reflect control reflexes that help to control how blood pressure, help to control blood pressure, help to control various body functions. In fact, those rhythms are seen pretty much throughout the body. Now, there are several different rhythms, and each of them represents a very important control reflex. One of them is called respiratory sinus arrhythmia, and it is related to respiration. As you breathe in, your heart rate goes up, and as you breathe out, your heart rate goes down. And that regulates the amount of gas exchange, oxygen, carbon dioxide, and it reflects the function of the parasympathetic nervous system, the system that gets more activated when you become relaxed. In addition to that, there are other frequencies that are embedded in heart rate. One of them is a slower rhythm, about 10 seconds, which represents primarily baroreflex activity. Now, the baroreflex, that's B-A-R-O, meaning from the Greek word for pressure, actually comes from stretch receptors in the large blood vessels in the neck. The baroreflex controls blood pressure, so that when your blood pressure goes up, your heart rate goes down. And when your heart rate goes down, since there's less blood flowing through the same size tube, then your blood pressure goes down. And that creates a rhythm. And that rhythm varies from person to person, but on the average it's about 10 or 11 seconds. And then there are slower reflexes, about every 20 seconds, 30 seconds or so. And that seems to represent another aspect of the baroreflex, and that's the vascular tone baroreflex, so that as your blood pressure goes up, your blood vessels dilate. And when the blood vessels dilate, then there's the same amount of blood going through a bigger tube, so your blood pressure goes back down again. But that takes place at a slower rate than the heart rate baroreflex. Today we're going to demonstrate heart rate variability by feedback, and I'll demonstrate how I talk about it to a patient, client, and how we do the procedure. Okay, so I'm going to put some electrodes on you that's going to measure your breathing and your heart rate. Okay? And this is going to be a band I'm going to put around your waist. That's going to measure your breathing. Okay? It's going to sort of expand as you breathe, and it's going to measure your respiration rate. So let's just put that around you here. And we'll clip it in place. And does that feel comfortable? Yep. Okay. And then if you would put these on your wrists. Great. We will slip these onto your wrists. And then we will start recording. All right, Adam, you're here because, as you've told me, you've had some problems with stress. You've had some anxiety symptoms, some hyperventilation symptoms. And what we're going to do today is demonstrate a technique that you can use to help control those symptoms, okay? Now, we've attached some electrodes to you that are measuring your heart rate and breathing. And some special things happen when you breathe in such a way that your breathing and your heart rate vary together. You know, every time you breathe in, your heart rate goes up, and every time you breathe out, your heart rate goes down. But usually it doesn't happen at the same time. So what we're going to do is find the rate of breathing where that happens, and also where the changes in heart rate that take place with each breath become very, very big. Now when that happens, it does some really special things for managing stress. So as you can see on the screen, your heart rate this is a beat-to-beat interval, is going up and down. And this blue signal is your breathing. And so as you breathe in, sometimes your heart rate goes up, and sometimes as you breathe out, it goes down. Now, I'm going to ask you to breathe at a particular rate. And when you breathe at that rate, something special is going to happen. That signal is going to become very, very big. So you'll be able to see this on the screen. So just breathe normally for a minute, and then I'm going to ask you to breathe with this green ball. So you can start doing that now, and when you breathe with the green ball, you're going to find that the heart rate is going to go way up. You see that? And then it's going to go down, and it looks like it's going up and down just at the same time that heart rate is going up and down. And that means that you're stimulating this very important baroreflex. And when that happens, it helps you to control your blood pressure and your stress response. All right, now I'm going to have you do some biofeedback, which means that I'm going to take this pacing signal away. And I'm going to ask you just to breathe in such a way that your heart rate goes up as much as it possibly can with each breath, and down as much as it possibly can when you breathe out. And you can use the heart rate to help tell you when to breathe. And that's doing really well. You're breathing about 6 times a minute. So that's what I'd ask you to do at home, to just breathe at about that rate. How does it feel?
Very good, relaxing.
Feels relaxing. Okay, notice that your voice sounds a little bit more relaxed. You notice that?
Yeah,
Uh-huh.
I feel more relaxed.
Uh-huh. Okay, so that's the procedure.